We all know a smile a day really can keep the pain away, and that's exactly what Operation Smile South Africa, in partnership with the Mpumalanga Health Department, is trying to do. It was a lovely couple of days this past weekend. The lives of 27 people with cleft lip and cleft palates were transformed. It's a 3-day surgical program taking place at Rob Ferreira Hospital up in Mbombela. MySchool MyVillage MyPlanet partnering with Operation Smile in this initiative. It's been going on for years, and it's always great to hear from them. General Manager Pieter Twine joining me this morning. Hello to you, Pieter. It's good to have you with us. And I've been following Operation Smile for years now, and it really is life-changing. We'll talk about funding and how many people's lives you're able to change in a moment. First, can we just take a step back, just remind viewers, what do we mean by a cleft lip or a cleft palate? Good morning.
Gareth, good morning to you and your viewers. Yeah, a cleft lip is a very common defect. Every 3 minutes, there's a child born with a cleft defect. And that defect really has a huge impact on the child's life as well as on the family's life. It causes health problems, it causes psychological problems, and it is very common, as I already said. It's the third highest defect found at birth within children. And it can be restored, it can be effectively repaired, if we can mention it in that way. But what we did this weekend was phenomenal work, and we need to acknowledge everybody that's been involved in making that happen. It's critical to do a restorative surgery within 18 months of birth. And we know that in South Africa, our medical facilities are overburdened, and there is not always access to easy, safe surgeries that can be done. What was done this weekend for those children is nothing short of a miracle. And the MySchool MyVillage MyPlanet program, in collaboration, as you already said, with Operation Smile South Africa, as well as the Mpumalanga Health Department. But I also want to call out the volunteers. Every doctor, every medical staff member of the team volunteered their time over this weekend to make a huge impact in the lives of those children.
And these are specialists that are involved in this as well, Pieter, that are able to get involved. It's the specialists, it's their assistants, it's the surgeons, everyone coming together as well. Is it quite a lengthy procedure? As you answer that, you mentioned it's best to do it, I think you said under 18 months of age since birth as well. But I imagine it can be done at a later age if need be. It's not ideal, but it can be. Correct me if I'm wrong, and tell me about the surgery itself. Is it quite costly?
Gareth, if you look at it overall, there's no surgery being too costly if you can change a child's life. And the MySchool MyVillage MyPlanet sponsored the surgeries over this weekend completely. There was smaller teams of people working with us to make this happen. But the surgery doesn't take long. It's about 45 minutes, and it is impactful. It's not that costly, but how can we measure cost when a child's life is changed for the better? And older children can be done. The surgeries then take longer, and it is more complicated. That's why it's ideal to try and do it at the beginning stages, because of the impact on the child's health and psychological well-being as well. It is ideal to do it sooner than later.
Now, of course, and we know as well at the moment that there's anything, especially in developmental years, ECD, early childhood development, Pieter, if there's anything that can affect their ability to speak, we then start getting into literacy issues as well. So this is also very important for education, a little down the road as well, once they get into, what is it these days, grade R, grade naught, etc., etc. What does the program look like for the rest of the year? Why, was it just this last weekend, or is it just because we're focusing on it? Is this sort of an ongoing program?
The program is really an ongoing program, but this is part of a support we provide over a 3-year intervention. And the team generally does the work once every year. And there is surgeries continuing throughout the year, but to do an intervention like this where we bring a lot of children together, we bring a team of medical experts together, that happens once a year, and we will continue to do that into the future as well.
Just as I start saying goodbye to you, Pieter, what sort of support do you still need? I mean, it looks like there's been massive collaboration between all the various role players that you mentioned earlier. I'm sure there's always another way to be able to help, though. Who would you call on? What would you need if given the opportunity? Just as I start saying goodbye to you.
Gareth, I think it's such a simple intervention with the MySchool MyVillage MyPlanet program. Operation Smile is one of our beneficiaries, and I just want to mention through the day-to-day swiping, we've managed to do a total of 179 surgeries over time, and that's huge. And it's literally by people just choosing to become part of the MySchool MyVillage MyPlanet program and choose Operation Smile as their beneficiary, and then swiping to make that difference. You know, we talk about make every swipe count. And this is such a simple way. We have to acknowledge our business partners that participate and contribute towards the MySchool program a percentage of the transaction value. And places like Woolworths, who contribute significantly in money every annual year to make these kind of interventions happen across the beneficiary base. We have over 8,000 beneficiaries that people can really support. And it is about choosing what makes a difference to you or what matters to you. And it's very simple. You can just SMS us on 31231 and say, join Operation Smile. And one of the team will contact you. And you as a viewer can start making a difference from today, or just download our MySchool app, choose Operation Smile, and you can start swiping and make an impact for the next child and the next surgery. And again, I want to reiterate, this is life-changing. There is nothing more important than changing the life of a child for the better for our country. And that creates such an amount of hope in the lives of those families and for their children. So we can just say, let's do it together.
Yeah, absolutely. Pieter, all the best to you and your team, the surgeons, the specialists, and of course, lots of love to the little ones whose lives are going to be changed immensely. Smiles for years is what we all hope. I hope I got the number right, Pieter. You said 31231 is the number that people can SMS. Is that correct? Give me a nod. There we go. That's the number that you can use.
That's correct. Thank you very much, Gareth.
Only a pleasure. Pieter, all the best to you and your team. General Manager Pieter Twine of MySchool MyVillage MyPlanet for Operation Smile this past weekend. 27 little ones have a whole new outlook on life. They're going to be smiling all the way.